Everybody, welcome back to the Southern Exchange Podcast with me, your host, Rico, aka Speakeasy Griff, Sir Griffington. So many names. But anyway, today I have another special guest in the building. We have a therapist in the house who's an amazing mother, who is an amazing daughter, who is a social worker, who is a person that is really for the people and is looking to help the people reach their highest level, especially with themselves. I've been knowing her for a while, and I'm glad I could get her on the podcast to talk about something that I think we need to talk about in our community a little bit more, which is mental health. So, ladies and gentlemen, I present to you Shanae.
Hey everybody. Thank you for all of that rundown. I wasn't expecting all of that, so I appreciate that.
Of course.
Yeah, it's a lot of different titles in there. I like it.
Yeah, I mean, you're a woman with many talents, so it's good to have people know about it.
Yeah, throw a little bit more in there. What you got?
Okay. She be styling, as you can see.
Okay, I like that
she
one.
She can dress.
Okay.
She always been able to dress.
Mm-hmm.
And like I said, she's a hell of a mom. Like I said, to her daughter, y'all just don't know. Phenomenal mom. But so today we're gonna talk about mental health. A little backstory into that, and we're gonna talk about your journey thus far in it, and how you took the step from social work to your own business. Correct?
Yes.
Right. Okay.
Private practice.
So let's get into it.
Yeah, let's do it. I'm excited. Thank you for having me.
Hey, like I said, you need to be here because I feel like in our community we talk about mental health a lot, but sometimes I feel like it's still like on the back burner, and people are still kind of unsure how they feel about it.
Yeah, definitely. I think this is a conversation that when I tell people, "Oh, you a therapist?" Everybody they want to talk about it, but they don't really want to talk about it. So I think that this is a good way to kind of have that conversation and just normalize, talking about mental health, talking about, things people go through, because we all go through things, so just opening that door so people are a little bit more just receptive and understanding of this is a conversation we need to have. So yeah,
Agreed.
I'm glad we're able to have it.
Same. So let me ask you this. What led you to become a social worker therapist?
So with social work, like I said, I initially started out as a social worker. Graduated from Georgia State.
Let's go Panthers. I'm at Georgia State now.
I know Caleb,
Caleb, the owner of the studio, actually went to Georgia State.
Okay, shout out to GSU.
Go Panthers.
So I honestly, I had this one career track. I thought I was going to be marketing. I thought I was just going to be corporate type of role. But then, I don't know, I just kind of, you get into college and then things just shift. You realize what's important to you. And then you start to ask yourself, could I really see myself doing this for the rest of my life? And I didn't see myself crunching numbers or doing that type of thing. I really saw myself helping people.
Mm-hmm.
That's always been something that I found a passion in. I think as I start off, I'm the oldest of 7. So I've always been in everybody coming to me, type of role, just being the oldest. I have a brother, 2 younger brothers. I have some twin sisters. There's a lot of us, let's just put it like that.
Yeah.
So I think always trying to be the one to help them out, my mom out, my dad out, and just being there. I don't always kind of push me into that helping profession.
Mm-hmm.
So then I was like, okay, I want to kind of change career trajectories. And I kind of was like, well, what does that look like? What do I really want to do? And the good thing about Georgia State is you can just kind of figure it out. And then you can go to different schools and kind of talk to them and see what career paths and this may look like. And the thing that I liked about actually getting into social work, it was okay, you can do this with social work. I didn't know that, because people think, oh, you're going to be working at
the welfare office.
No, it's one of the most different degrees you can have as far as the many different professions.
Like the placement, like where
the
you can
placement,
be.
yeah, like where you can be. So you can be corporate social work, like doing trainings on diversity and equity and inclusion and stuff like that. You can do something where you are working in like macro social work. So you're creating policies for people, for the homeless, for, you know, housing.
It gets that deep.
Yeah, it's so many different avenues. So people don't really realize, like, there's macro, like on a big scale where you're creating policy, you're working with the city, you're working with local offices for all this. Like, people don't realize there's a lot of funding that comes in from the government, right? And there has to be somebody to say, okay, this population needs this. Like, how can we allocate it and make sure it actually goes to the people? Like, what are their needs? You know, so those are people that work in social work. Or there's micro social work where there are people that are working directly with people, which is kind of something I do, where I'm actually trying to help that individual get to a better version of themselves, if that makes sense. So that's on the micro level where it's just like you and me talking.
Like I said, the intimate level.
Like on the more intimate level, because, you know, it's good with policy. Like sometimes it takes a while for you to really see the outcomes with that. But I liked like actually working with people so you could be like, oh yeah, like, you know, Miss Benjamin, she really helped me out right here. Like they can, that I liked, like where it's like, okay, I can actually see this person I helped or see the outcomes and I directly impacted that. Like, so that's what I liked about it. So that kind of is what led me into going into social work. And then I realized like, okay, like you can actually, you know, you can make money in this if you get clinically licensed. So that was my route. So I'm a licensed clinical social worker. So I'm clinically licensed to do therapy. I can diagnose. I'm not a psychiatrist. A lot of people get...
But I say, because, like, can you tell the people, like, who know the terms but don't know how they're different, like, between the two?
So that's a good question, because I actually start off when I have new patients that come to me. Like, I kind of start off with, let's just kind of like have an open book here. Like, I know that there's so many different titles and you're probably wondering what the difference is. Like, what's the difference between a psychologist and what's the difference between a licensed marriage and family therapist or a licensed LPC, licensed counselor, licensed clinical social worker, psychiatrist, all those different things. And I like to say that we all are able to do the same thing. Like, we all, you know, can diagnose and do that. We're all clinically licensed. It's just our approaches are different.
Gotcha. It's about the approach.
The approach to therapy is different. So as a social worker, you know, I've worked with the homeless. I worked with children. I worked with older adults. I worked in these certain type of communities and over here, over there. So my approach to therapy is just very holistic, because I really see things from all different perspectives, versus somebody who's like a psychologist or a different, you know, counselor. They may see things more of like, you know, the brain is reacting this way. So this is, you know, your response, versus understanding, well, your environment plays a lot into it. Yeah, like
your makeup is pretty much off of where you were raised and what you were introduced to and what you were exposed to, in a sense.
Yeah, so that kind of goes to the debate of like nature versus nurture type of debate, right? Like, you know, some people feel like, you know, our environment does impact who we become, versus, you know, we were just kind of born, you know, this way, and nothing, our brain chemicals just kind of, you know, react to certain things. But I think that, you know, our environment, where we grew up, our family, you know, different experiences we have definitely shape who we are, and it affects our mental health. It could be in a positive way in some different aspects, and it can be in, you know, a negative way in different aspects if we haven't really truly understand how it has impacted us, you know, in our daily lives. So that's kind of my approach. So I always preface my clients by saying that, like, we get into everything.
Yeah, we touching on all of that.
We touching on all of that, because whether you know it or not, that's affecting how you see things. That's affecting how you move. Like, that's affecting the relationships you have with other people. Like, all of that is relevant and all of that is important. So, yeah.
Nah, I like the way you broke that down.
Yeah.
Because I think sometimes some people don't think too much into it. They just think they're just making a decision, and it's just a decision. But don't understand that something may be affecting that decision and why you're, responding this way, reacting this way. Yeah, because trauma is real.
Trauma is real. I feel like trauma is something that a lot of people say is like, I had trauma from, sixth grade and eighth grade, and it could be factual, right? People, have responses to trauma they don't even realize that they have. So trauma is real, and it's one of the reasons why you need to go to therapy.
So, what is Shanae's approach to therapy?
Okay, that's a good question. And I actually get that question a lot from like people I do consultations with, because I think it's important to do consultations when you're seeking out a therapist. So make sure you get a consultation, because you want to make sure it's the right fit.
Free consultation, right?
Free consultation. Okay. I do free. Some people don't do free consultations, but I think it's important that you do a consultation with potential, clients. I do that. And then if you're seeking out a therapist, you do a consultation to make sure it's the right fit, because it's really important if you're going to be getting into, things that are going on in your life, trauma, that person is somebody you could actually feel open to share with. So like that's, one of the approaches I have in my, with my therapy. I kind of preface it by saying, I'm going to make sure it's a collaborative type of, relationship, therapeutic relationship, right? I'm not going to just sit there and just listen. I'm going to listen most of the time, right? Because you want to make sure you're, really getting to understand what that person is going through and why they're seeking therapy, and listen. But you want a therapist, or I like a therapist, it's also going to be challenging. So they're not going to just nod and just say, yeah, you were right. No, if you were wrong, you need somebody to point it out and say, hey, did you think about maybe, from this perspective, or, what about this? Have you ever thought that maybe, this could be something that you need to work on based off of what you're telling me? So if you don't want somebody to tell you the things that maybe you could do differently, then you might want to see another therapist, because that ain't me. But it's therapists out there will just take your money and just do the sounds good.
It kind of be like a yes man.
It's like a yes, but are you really truly being helped? Like, are you really truly getting to what you want to fix? Because if you want somebody that's going to listen to you, you could probably get
anybody.
You can get anybody to do that.
Whoever got an ear and they want to listen.
Right. You can get your grandma to listen to you. It's like, yeah, that's right, baby.
Right. And the whole time she checked out, she like, well, okay, yes,
yeah. So that's why if I like to have a collaborative approach. So we're gonna, make sure it's a good fit, and that means, hey, being open. I always say I'm a judge-free zone. So I don't want you to judge me. Like, that's not what therapy is for. Therapy is for you to come in and be vulnerable. Like, I feel like a lot of people have a difficult time being vulnerable, because we live our lives where we have to kind of present in a certain way, like most of the day. Like, when you think about it, when the last time you were able to just sit back and be vulnerable and like really be yourself?
It's tough, because you just said most of the times as people we put on this persona or this act every day, whether at work, school, whatever, and it's like, are we really truly being our authentic selves? Because we're in spaces that we feel like sometimes that we're not comfortable in, or we feel like somebody may judge us because of how we move or how we speak. So sometimes being vulnerable is not an option, because it's just like if I open up, and then they be like, why you know what I'm saying? And then it's just like, now you shutting down all over again.
Right. Like, that's what a lot of people do. Like, they're worried, they're anxious about how other people are going to take them for who they really are. So they're presenting in a certain way. So a lot of times when I'm meeting my clients and we're talking through some things, they don't really know who they are. And we have to first go on a journey to figure out, who you are as a person, because how can we really help, in certain areas if you don't even know.
Yeah.
So that's I've been finding that a lot lately, of people just not really knowing them. So we'll do some things where we just kind of just talk about, like, what are your strengths? You know, like, what makes you you? Like, some people don't realize they have a lot of positive attributes, a lot of strengths, and they just think it's, oh yeah, that's not really nothing. But no, like, you don't, like, you're creative. You know, it may be somebody else that don't have that creative, you know, spirit, quality and spirit about them, right? But that's a strength that you possess, right? You're outspoken, you're a go-getter. Like, all these are strengths that make you, right? You know, so like honing in on what those are really helpful with, you know, understanding how you can, you know, maneuver in your daily life if you could hone in on those strengths. So that's one of the ways that we kind of approach that if you really don't know who you are. So
yeah, that was a bar right there. Thank you for those kind words too. But now you're right, because you need to know who you are to begin to start that process. And so when somebody's unsure of like who they are, and you're having these consultations with them, or I guess they're seeking it out then, but when somebody's trying to seek a therapist, when they have that moment where they're at home or at work and they be like, I don't know who I am, like, how does that approach happen? Like, when do you tell somebody, like, I think you may need to see a therapist?
That's a really good question. I think that, you know, even you contemplating seeing a therapist, it's something in you that's saying like, hey, like, something's not right. That could be even just worrying too much about things you never worried about. Like, sometimes it's just like you can't get certain worries out of your head, and then it starts to affect you, like, physically. Your palm sweating, your brain is like foggy. Just you don't feel like yourself, right? Or you've always been that way, but you like, maybe I need to like switch it up, because you may see like, okay, this isn't normal to be, you know, worried all the time or anxious all the time, or, you know, playing that kind of, you know, what if game, or catastrophizing things, or, you know, all those different things that, you know, cause us to feel anxious and things like that. Or it can just be where a lot of people are just really sad. Like, you just constantly feel sad and just your mood is low and you don't know why, and it's kind of hard to get out of that, and it kind of becomes a cycle. Like, there's things that you may do, like you may go out with friends and, like, you know, hang out and, you know,
but still feel sad, even though you out with the friends
and still
and everybody having
sad.
a good time, but you still in your body like,
yeah, a lot of people feel like that. Like, they just don't know, like, they're just doing things to do them because they feel like they should, but internally their mind is somewhere else, and internally they're just feeling depressed. So that's something where, yeah, like, if you're feeling like that, then, you know, you may want to talk to a therapist, right? Like, you don't want to continue, like, I always ask people, like, what's your quality of life right now?
That's a great question.
Right, because so the reason why I asked that question is because I worked with older adults, and one of the things that I used to ask them was, like, what's your quality of life? And the reason I used to ask them that question is because I was somebody who would kind of be like, okay, you may need help in these areas, and, you know, older people are stubborn, right? Like, no, I don't need no help. Like, I can do it. They're stuck in their ways, but they're going to the hospital a lot. They can't feed themselves. Like, they're, you know, diminishing in, you know, certain areas. So when I worked with older adults, I would, you know, kind of pose that question to them. And it really became helpful in my private practice of, like, okay, Mr. Such and such, like, what's your quality of life right now? Like, on a scale of 1 to 10, because, you know, your house is looking a little messy, right? You really can't, you know, get up and go like you used to. you're not really social. You're not really talking to people like that.
So it's kind of like they're isolated.
They're isolated. You know, like, are you eating? You know, can you really say you have a good quality of life?
You're like, are you able to do the necessary functions to operate on a daily basis?
Yes. And actually feel good about it. Right? Like, because it's not just like, okay, I can go to the bathroom, I can cook a meal, but like, it's so much other things. That's what I said. Are you social? Like, are you getting out? Are you talking to people? Do you have people checking in on you? Do you have that social connection? Like, all that encompasses your quality of life, right? So I kind of took that from when I was working with older adults, because they'll be like, it will kind of make them question, like, man, yeah, my quality of life kind of sucks right now.
Yeah,
like,
subpar.
How can we make that better? And maybe we do need to get a caregiver to come in, or maybe we do need to get you to go to the senior center for a little bit so you can interact and be social. Or maybe we do need to get you Meals on Wheels, because you're really just eating hot dogs, and that ain't helping your blood pressure.
Right. And maybe the reason why you in and out of the hospital.
It's all connected, right?
Yeah.
So that was a question I posed to them, and then I use it now, like I said, with, you know, working with my clients, is to ask them, like, what's your quality of life? Like, do you feel happy? Do you feel like, I always say, like, on a scale of 1 to 10, you know, like 10 meaning like, yes, I'm doing my thing. My life is good. Like, everything is happening the way I want to happen, versus 1, like, my life just sucks.
Yeah.
Like, I kind of like do that scale, and then people will give me a number, and I was like, okay, well, you know, what's the reason why you gave it this versus that, you know? So I always try to, you know, my approach to therapy also is like pulling out their strengths. So I was like, okay, what's the reason why you said a 5 and not a 2 or a 1? So, you know, let's start there.
Yeah.
Like, let's start with where you're at. Like, that's what a good therapist will do, is like start with that
at the
client
present moment.
Yeah.
Okay. And with you speaking about working with older adults and their life and where they are mentally, like, how do you see Gen Z and millennials, like, how do you see them taking care of their mental health, especially in this climate where we're talking about it in a sense, but it's just like, how does their approach to it look versus someone you're dealing with that's a little bit older?
So I will say that the older adults, they're a little stubborn, you know.
And they come from a different time. Where it's like back then, like, a lot of them, when it came to mental health, they just pushed everything aside. They woke up every day just like, I'm going to figure this out. Gen Z and millennials.
Okay. Gen Z, I'm a millennial. Hey, millennials.
You know what? I be forgetting, like, what's the years of Gen Z and millennials? Because I don't know.
That's a good question. Somebody got to look that up. I think millennials are like, stop it. I don't know.
Let me look it up real quick.
Look it up.
Yeah,
Okay. Because now it's like
millennials.
Now it's like Gen X or Y is a new one.
XVB, something. I can't keep up with this stuff.
So
I know what baby boomers are, because my dad's a baby boomer.
Right.
That's the only reason I know that.
So, and that's when we're talking about older adults, like baby boomers, like that generation. But when I think about millennials, I think about people who are, you know, my age, a little bit older, and then Gen Z is gonna be towards, like, you know, more younger, 20s, teens, like that.
Because it says millennials are anyone born between 1980 and 1995.
Okay.
So that's us.
Yes, that's us.
And then Gen Z, I don't put Gen Z. That ain't it. Hold on. Gen Z.
Okay.
All right, and Gen Z is anybody, like you just referenced, born between 1997 and 2012.
Okay. Yes. And so I didn't even realize my daughter was Gen Z.
Because you're right. Because it says 11 to 26.
Yeah. I didn't even realize that, but yeah, I have a Gen Zer.
You know? So it's like how does that approach look? Because even though millennials and Gen Z are kind of close, it's still that difference in like how society is versus in 95 versus 2000.
Right, and it was something that I was reading about, like millennials being that last generation to have like a little bit of dose of not having cell phones, and computers, and knowing what that looks like, you know, having, you know, not having things easily accessible to us, I guess, versus like the Gen Z and new generations, like just having every kind of answer and, you know, thing they want to know, you know, to kind of just Google or do a search or search on TikTok. But then that so then that creates something where like everybody is kind of diagnosing themselves in a sense, like or diagnosing other people. So I think that it's a good thing that I will say that I think millennials and Gen Z talk about mental health a little bit more than, let's say, the older adults. So that's a good thing because it's a conversation.
Right.
And I think the taboo of actually seeking a therapist and talking with a therapist is slowly kind of disseminating. Right. Now it's like, you need to talk to that lady.
Right.
Right. Like now it's kind of like,
you need to talk to somebody.
You need to talk to somebody. Like now it's like a conversation piece of, oh yeah, my therapist told me, or, you know, it's just more acceptable. So I do like the fact that millennials and Gen Zs just are more
open to having that conversation.
Yeah, open to having that conversation because they know, like, okay, maybe my parents, you know, I don't want to be
I don't want to be that kid that goes to therapy and my parents and nobody in my family ever went and I'm the oddball now.
Yeah, or like I don't want to be, you know, older and I haven't processed through certain things. I don't want to be, you know, like my parents in these ways where I've just never processed trauma. Right. I've never processed certain emotions. I don't know how to express empathy. I don't know how to, I don't even know what love feels like because I never experienced that. Right. Like I want to, like, so people do want to be better and I commend them for that. Like, this generation, like they're taking the steps. Like I said, it's a good and the bad thing because everybody diagnosing everybody, and it may not actually be the case.
Yeah. Especially with social media.
But on the opposite end, like I said, it gets people actually talking about mental health. It gets people, you know, looking and trying to find somebody. So that part I do like. I think that I do see a difference with what millennials are kind of going to therapy for versus Gen Z. I think millennials, from the ones I've seen, it's a lot of relationship issues and, you know, unresolved trauma. It's a lot of also like self-doubt. So that like imposter syndrome and self-sabotaging behaviors and like kind of wanting to do better with those types of things. So I do see a lot of millennials kind of going through that versus, you know, Gen Z. I think that they have a lot of anxiety and depression. And, you know, that could be related to like social media and like just them growing up in that era. And, you know,
where everybody's life is on display and it's like
everybody's life is on display.
Somebody you know is doing a certain thing where it seems like their life is in order and yours may be a little different. Sometimes people try to play that comparison game.
Yeah.
Which can lead to anxiety, depression because you feel like you're not enough or you're not living up to the standards of your peers.
Yeah, that's exactly it. Like a lot of people are just, you know, feeling like stuck or just like worried about things that I feel like maybe we didn't worry about because it was just like, you know, it wasn't something that we had to see all the time. But now it's just so accessible. People see it, you know, it's just, I see
all in your face.
All in your face, right? So I think anxiety, depression, even like suicidal ideations, like it's really high in that population.
You said suicide what now?
Well, I said
ideation. What's that?
So
I don't know that term. I ain't like I know it. I don't.
So when I say ideations, like that's just like kind of the thought.
Oh, okay. The idea.
The thought, like, okay, I just
you.
don't want to wake up today. Like, I just would be better off if I just wasn't here. Like, type of. So we say ideation.
Got you.
It could be, and so another thing I did was crisis intervention and assessing somebody's suicide risk. right? And so that's what I will say, like suicidal ideation. Is it passive or is it like active? Like, do you have a plan, intent? Like I had to ask those questions. So that's something that I also kind of will assess if I'm getting somebody and they say, yeah, I thought about this. Because people don't realize, well, I hope people do, out of, everything we're seeing in social media, people are really going through with this and really, committing suicide. And it's become more and more prevalent. That's why I said in that Gen Z population, even millennials too, but like this is a conversation, and a good therapist is going to ask you that, like, okay, have you thought about this? And a lot of times people don't realize when you actually talk about suicide, the person is less likely to actually do it. So don't be afraid to have that conversation with somebody who has had any type of thoughts, because when you actually talk about it, it's like, okay, it makes them feel supported. It makes them feel like somebody actually makes them feel heard, like somebody actually cares. So that's a part of what I do too as a therapist, is making them feel comfortable enough to really share with me, okay, if you are having these thoughts, how can we make sure you're supported?
Okay.
Like, who do we need to, because I'm gonna call you and be like, is everything good? Like, because I want you here. And that's one of the things I say. Facts. Like, I want you here.
So that was great, the part about suicide, because that's definitely a topic that needs to be discussed. So I also want to ask you about, because I think we might have touched on it before, but what are like some buzzwords right now in therapy that are prevalent?
So when we were talking about like millennials and Gen Z, like that's definitely something the buzzwords have kind of contributed to people looking into therapy, because they're quick to kind of be like, oh yeah, they have that, or having those different things. So I would say, I think right now there's a couple that I do hear a lot.
What are those?
So I think right now I get a lot of narcissism or narcissist.
Yeah. Get that a lot.
So I get a lot of people coming to me like, I need help dealing with my narcissistic mother, or dealing with a narcissistic boyfriend, or just like, how do I feel like this person is narcissistic and it's affecting me. Like, so I feel like everybody thinks that somebody is narcissistic in a way, but I kind of break it down, and I'm kind of like, okay, narcissism actually only affects 1% of our population. Like, actually, narcissistic personality disorder, because it's a personality disorder to be narcissistic. Like, it's something that has to actually be diagnosable. So I think it's a lot of psychoeducation that I do, and then they're like, okay, maybe they are not a narcissist, but they have narcissistic traits.
Gotcha. Right?
Like, so then we break it down. Like, okay, maybe, they don't have the full-blown personality disorder, but you can have narcissistic traits. That's a fact, right? Yeah. Like, you can, it's people out there that definitely possess it, okay. Right? So, we kind of talk about like what that looks like with them going down those traits. Is this person, gaslighting? And that's another buzzword. Well, they're gaslighting me.
Folks be saying, don't gas me up. I'm like, when they first started saying that, I'm like, what are y'all talking about, gassing up? I'm like, I put gas in my car.
So and what I say about gaslighting is, it's a form of manipulation. So when I go into like, okay, this is a narcissistic person, and then we talk about gaslighting, what are some of the things that this person is doing, right? And then we'll actually confirm like, oh yeah, that is gaslighting that they did. Like, that's a form of manipulation that people don't realize they're actually in. So one of those types of gaslighting warning signs, I like to say, is it can be denial. So let's say you're interacting with somebody, like you have a relationship with somebody, whether you're family members or other people, and they just kind of just you know, something may happen and they just kind of like deny that it even can. Like, I don't know what you're talking about.
Yeah, brush it off. Like,
brush it off, you know, like avoidance. So just trying to avoid the whole conversation together when it's something you really want to talk about or really want to address. Oh, we'll talk about it later. They turn up the TV, you know, they leave. They don't address what's kind of going on, or they project things. That's another type of gaslighting. Warning sign of projection, right? Like, oh, you must be, why are you questioning me about that?
Yeah.
Like, why do you feel this way? It must be because something's going on with you, right? Like, they're projecting a lot of things. So gaslighting, narcissist, are some of the things that are buzzwords right now. Everybody's triggered.
Yeah.
So like, oh, this person triggered me. So I have to break that down too, because are you triggered or is it a trigger? Because it's something totally different. Like, is it? So I like to say, okay, is it natural? Is it a natural emotional response that, like, you stump your toe, you feel like, you know, that wave of emotion, like, dang, like, you know, like, like that's a natural response. So a lot of people kind of are blaming, oh, this person triggered me, and that's why I reacted this way. Like, no, you like that's you can't blame everything on something triggering you, because maybe something that you did is not something that is a natural response to whatever interaction took place. Is that so? That's what I kind of break it down. Like, okay, you being angry, that sounds like that's a normal response. Versus you doing this, and this, and, you know, everything that something might happen, like, and they say, oh, well, that person triggered me. That's something different.
Yeah, it was just, that's just who you are. Like, if nobody triggered you, like, you just respond like that all the time.
Right. So breaking that down. And so if that's the case, like, we need to work on, you know, why are you responding this way? Versus you saying this person is triggering me and causing me to do that. Right. Like, so kind of turning it back on them, because again, with somebody like a narcissist, you know, we think about, okay, who this person actually is, you know, and a lot of times I'll flip the question. I'm like, okay, well, people don't want to, well, a lot of times when we categorize people, it just kind of makes us feel better. Because when we can say, hey, you're this.
Yeah, we can place them in that box.
We can place them in that box. We can justify a lot of different things. So we like to categorize people. We like to categorize them as a narcissist. We like to categorize them as this way, you know. So versus saying, you know, that's not really it. So a lot of times I'll break it down and I'm like, okay, well, what you're telling me, is that somebody being narcissistic towards you, or is that like actual abuse? Like, is that emotional abuse? Because some people don't want to be labeled as like, oh, I'm being abused right now, or versus I'm dealing with a narcissist and this is how they're treating me.
Right.
So it's easier to just kind of label them as like a narcissist versus kind of breaking it down. Okay, well, if they're doing this, that sounds like some emotional abuse to me.
Yeah. And we need to focus on that. And
we need to focus on that. Yeah. Or we need to focus on forming a resistance to these things, but you need to know what the signs look like.
Right. And so when you speak about triggers, like, what steps should somebody take when they're trying to address trauma? Like, when they say something is triggering them, and it could be a response to something traumatic that happened in the past. Like, how do you go about addressing that, or how does someone go about addressing that?
So I think with trauma, you want to make sure that, I guess the first thing with dealing with trauma is actually acknowledging that you're experiencing what you're experiencing.
Okay.
And that you actually, and sometimes people need that clarification. They come to therapy and I have to be like, that was trauma. Because they like kind of know, like, oh, this happened.
But don't necessarily associate it with trauma. They just feel like it was my life and just something just happened in my life.
Yeah. And it, especially with, you know, people that look like us, right? like we go through a lot of different things going up.
Traumatic, like
right?
Man.
And it's not till you come to the therapist.
Right.
Or it's not till something happens and you're triggered and then you're like, okay, yeah, maybe that was trauma and maybe I'm having a trauma response to this trauma. So that happens a lot in therapy where it's like a breakthrough of like, oh yeah, I experienced trauma. So when we know that it's trauma, we're able to treat it, right? Okay. So when we're able to like identify it, label it, that goes a long way. And then we can have just a supportive environment of like validating your experience. Because a lot of people don't feel validated in what they went through in their particular experience. And that's what therapy is about, to kind of validate your experience. Because one of the things I like to say is you're the best expert of you. Like, I'm talking to you, but like, you know you the best.
Very true.
You know you the best, Derek.
Yeah, because can't nobody be you but you.
Can't nobody be you but you. So it's important that you validate your own experience. And it's like, yeah, that did happen to me. Or yeah, I do feel like this. Yeah. Instead of kind of brushing it off and
pushing it to the side and talking about, oh, I deal with it and then never really deal with it. Because it's a journey, right? It's like a healing journey. Like a journey to heal is a process.
Yeah, it's a process. And that's another thing I kind of say, like, it's not going to happen overnight.
Yeah.
But we'll get you there.
Shanae.
Derek.
As a therapist, how do you practice self-care?
Good question. I actually had one of my clients ask me that, like, who do you talk to?
Right, because you know you're gonna have that pushback from someone like, you talking to me about this? What you be doing?
Or just know, like, because they really understand that we hear a lot of things.
Yeah, right. Y'all do.
We hear a lot of stuff, and sometimes you like really if you're a good therapist, like, it does kind of get to you sometimes, like, wow, this person really went through all of this. And so a good way that I kind of just am able to like be empathetic, but also still go about my everyday life is just to, like I said, the same way I tell them to normalize what they're feeling, I have to do it myself. So I try to just like, okay, ooh, that was a real tough one, right? Like, I acknowledge it, and then I try to just make sure I like just kind of go into a space where I'm like meditating or just kind of just like taking a mental a brain break. I like to say brain break, and then I'll get back and I'll just refocus. But another way to kind of get my mind off of everything is the self-care. So you know me, I be traveling.
Yeah, you, because when you just in like, let me see if I got it right. You can probably correct me if I'm not. Iceland, Greenland?
So I went to Iceland.
Right.
I enjoy Iceland. I went to Ibiza and Spain and Italy, and I try to at least take a trip every other month, even if it's like locally, even if it's a staycation.
Yeah.
So that's another thing I tell my clients is, you got to practice self-care. And it's like, well, I can't, I'm like, okay, that could be getting a hobby. Like, what are your hobbies? Like, what's something that's a positive distraction? Because we have so many negative distractions. Like, what's a positive distraction that we can start to implement in your everyday routine?
Like you said, it can be something small, like going to the spa or taking a stroll around the park. Something, whatever you can implement into your daily routine outside of just like kind of dismissing it like, oh, I can't make time. Because we can make time. It's all about how we approach trying to make that time.
Yeah, people make time for the things they want to make time for at the end of the day.
Facts.
And we make time for other people, but we have to make time for ourselves. Like, that is important. So that's why I try to walk the belt line. I got my skates. I be, skating, do a little 1-2 here, skating, do a roll bounce. Like I said, travel. I've been really getting into like flower arrangements. So I'll go to like Kroger or like Aldi or something, and then or Target. Like people don't realize they have the flowers that are like 20% off, like already on sale.
Mm-hmm.
And then I just kind of gather some, and I like kind of just put them together and arrange them. So I like doing stuff like that. I've been really getting into baking. I'm a good cook.
Yeah, you are. You are. You can cook.
Yeah, but I also want to learn how to bake. Like I never really touched on baking. I think that's your skill, is baking.
I do a little baking.
Yeah,
I do a little baking.
So I'm trying to get like you and like bake a cake and stuff. I never got into like baking like that. Like I can cook, but baking. So I've been trying to like bake my own bread, and like I did biscuits the other day, and I was like so happy.
Homemade biscuits.
Homemade biscuits.
You put the butter on top.
I did,
Okay,
and I put a little honey. Was that supposed to put the honey?
Yeah, no. Honey butter biscuits go off.
Okay,
that's what you supposed to be doing.
Okay,
like you know what I'm saying. Like if you ain't put, I mean, I ain't gonna say if you ain't putting honey, you're doing something wrong. But when you're exposed to honey butter biscuits, it's a game changer.
So I've been getting my baking skills up, and then like I said, I go out and it's really about also having a good support system. So whether that be friends or family, just having people around you that support you and like understand, like, okay, she don't want to talk about work, we ain't got to talk about work,
right?
She don't want to do this. Like I'm gonna just, we're gonna do something totally different. Just get her mind off. Like having that support system where they already know, like they already know you, and they know when you're having a good day.
Right.
They know when you're having a bad day.
Right.
And you're not like yourself, and they can point it out and say, okay, let's go grab a glass of wine.
Right.
let's go
do something.
Let's go do something. Like that's really important.
Yeah, and you need that. Like you need that support system, because when you have that good support system, when it's you feeling like that, they bring you out of it. And then when they're feeling like feeling off, you bring them out of it. And it's like a give and take. It's like it's a healthy support system. Some people have support system, but it's not healthy.
Yeah.
It's just like they have friends that kind of take from them, you know what I mean, and not really pouring back into them. But it goes back to what you were saying. You have to pour into yourself to pour into others. Like if you want to have self-care, if you want other people to have self-care, you got to give yourself self-care too, because I can't tell you to go do something that you enjoy if I'm not doing something I like to enjoy. It don't work like that.
Yeah.
So that's good. And
so how are you practicing self-care? Because now let me be your therapist here, because I know.
Who, me?
Yes, I know you got a lot of stuff going on. Work,
man.
School.
Ooh, I feel like I'm in therapy with you. Okay, all right,
yes.
we're doing therapy. All right. Yeah. So self-care for me is I work out, so I go to the gym.
Okay.
That's one outlet. I like to travel as well. And I just travel. I just came back from New Jersey and New York a couple of weeks ago. So it was good because I was able to visit my cousin, and I also was able to visit a young lady that I've been talking to. So like they were dating, and I don't know, just seeing both of them was good, because my cousin, for one, I don't get to see a lot. So it's just like, cause she's busy, I'm busy. She lives in New Jersey, I live here. So that was good, and we actually got to catch up. I got to meet her dog, Kai, and I got to play with him. He was pretty much on me the whole time I was there. So he kind of made me feel good, because I was going through a rough week, and then when I come in her house, he runs up to me. He just wanted to play. I'm like, life ain't that bad. Like, sometimes you just got to play. And then, like I said, I was able to go to the Bronx, and my friend I'm dating, like, we were able to go out. We went to a distillery. We just did stuff. We were out and about. So it was just like, it felt good to be out, to see her, to date. And then, I don't know, it just felt good to be away from Georgia and do something different, because normally when I'm at home, I'm at work, or I'm at school, or I'm trying to do a shoot or something, like with photography. So it's just like I'm always getting pulled in so many directions that some days I sit down and I'm like, I ain't do nothing for myself in like 2 weeks. So I'm like, I can't keep doing that. And it's like, I just try to be present most of the time, and just really try to do something I like. So that's really like working out, traveling, and when I can, going to the gun range.
Okay.
Pop that thing off.
Yeah. Okay.
You know what I'm saying? It's better to know how to use it than not know how to use it.
Right.
But yeah, that's what I do. But of course, I like other stuff. I like to read. I like to write. But yeah, those are some of the things I do to have self-care. And I actually need to go back and start getting spa treatments again, because I miss getting massages, because that was a real way I used to treat myself. Like,
love a good massage,
man, because when they get to give you that deep tissue massage and they hitting all them
they
spots,
be hurting sometimes. I don't know about you.
Well, I mean, it depends on if you got. I don't know. Yeah, it depends. But I know when I did have a massage therapist before she stopped, I could walk out of there feel like jelly. I walked out of like I ain't had no feet. I could walk, but I don't know how I was walking because I didn't feel no feet. But yeah,
okay,
so that's what I
need
do.
her number because.
But she don't. But that's the thing. Like when the pandemic happened, like she kind of like stopped in a sense. Like she started back, then she just decided to get out of it. But she was amazing. But she just stopped.
Okay, well, if there's any massage therapists out there, like, you know, hit me up because I need a good massage. That was one way I practice self-care too. So yeah, I get that. But it sounds like you practice self-care a lot and you prioritize it.
Yeah, but I could be better though. I'm not gonna lie.
Okay.
I could be better because the past few months, like I haven't really done anything outside of when I took my trip. And I was kind of upset with myself because I'm like, man, I usually try to find some way, like you said, even if it's going somewhere locally, I get out and do something. But this past semester, I just been trying to juggle these classes and the level of work I've had to do because it's like, you know, I'm a film and media major, so it's like one class I got to write a pilot script, one class I got to shoot a short film, you know what I'm saying? One class I got is sound design, so I have to build sounds, audio, visually, so it'd be a lot. And you know, I be hard on myself sometimes. I'm like, man, I'm trying to do all this stuff, but it's just like in the midst of doing this, I got to balance this stuff out. Like, I just can't go 100% 24/7 and just burn myself out. So it's always trying to check in with myself and reflect. Like, okay, D, what do we need to focus on right now? What do I need to prioritize for today? Not next week, today, Monday at 12 o'clock. So yeah,
I like how you broke that down, like self check-ins.
Yeah, you gotta have them.
Yeah, because I like when I work with couples, sometimes I say, are you having like a relationship check-in weekly? But it's also good to have self check-ins because, like you said, you can't give to other people if you don't have anything.
Yeah, you can't pour from an empty cup.
Right.
I mean, you can pour, but ain't nothing coming out.
So yes.
You feel me?
Mm-hmm.
So I know I asked about self-care and everything, but another question I want to pose to you: what steps do you take to be the best version of yourself?
To be the best version of myself?
Yeah, the best version of Shanae.
Ooh. So I try to just practice what I tell other people, like as a therapist. And one of the main things I try to do is, I think I mentioned it, like validate my own feelings and validate my own experience with things.
Okay.
So that just makes me feel more in tune with me, because I can say like, okay, today you felt this or today you felt that, and it just makes me more in tune with what's going on with me mentally, because I don't want to be dismissive of that. So that makes me the best version of myself, because then I'm able to be the best mother. I'm able to be the best sister, daughter, because if I'm not acknowledging that I'm feeling certain types of ways or I'm going through certain things to myself and I'm being dismissive of it, I can't, like you said, pour into people that really need me. Right. Like my child, I was listening to, I think, a podcast, and one of the doctors or therapists was saying, like, what's the number one indicator of like people not being happy when they get older, or something along the lines. And it was like them being younger and not seeing their parents happy. And that was like an indicator, right, of like, if I'm, you know, angry, if I'm, you know, sad all the time, and my daughter sees that, right, like, what is she seeing the best version of me? So I think it's important that I just kind of, if I know that I'm going through something, like, check it. Don't dismiss it. Like, check it then. Like, acknowledge it now. You mentioned a word, accountability, like being accountable for what's going on with me makes me the best version of me.
And in the midst of that, like you just mentioned your daughter, do you kind of show her like all sides of you when it comes to that? Because I know being a mother, like with your children, you want to protect them in a sense, but you also want to show them like your emotions and how you process things, because I know you don't want her to feel like you're just like this person that can just process everything and never show any type of emotion. So like, do you show her different sides of you? Like if you're having an issue or having a challenge or obstacle you're trying to overcome, do you be like, hey, London, mom is like this because of this? Like, do you break it down to her like in that sense?
She's a little bit older now, so I'm okay with that. I may not have done it that way when she was a little younger, but now that she's a preteen, right? Like they're going through a lot of awkward stages, right? So I just want to normalize some of her feelings and validate her responses to things. So I always say, like, you're your own person, I'm my own person. I may react to things this way, you may react to things that way, but I think it's important that I show love and empathy to my child. Like I think that kind of goes a long way, despite if I'm having a bad day, because at the end of the day, because I've showed her so much love, because I've showed so much empathy, she pours that back into me. So she knows, like, maybe mama just need a hug, or maybe I just need to go ahead, like she'll cook some dinner for me, like she'll see it. Or if I ask her to do something, she kind of knows, like, okay, like I'm gonna go ahead and do it because this is something that I know my mom would appreciate. Like this is a way that I show her I care. So that's kind of.
I love that.
Yeah.
I love that.
Shout out to you, London, my baby.
That's that's good. Like I said.
Oh, you tearing up?
No, I'm just saying because when you mentioned the part about like mom might need a hug and just picturing your daughter going up to you giving you a hug on a day that wasn't the best, like just having that unconditional love in the house, is beautiful. And sometimes it doesn't get recognized enough. Everybody always wants to talk about what's going wrong in the household. Nobody ever wants to talk about what's going right in the household.
Yeah, and I'm not gonna say every day we're just like
peachy perfect and honky dory.
No, because she's a teenager and she will she'll definitely do something where I'm like, girl. Because
you remember how it was when we were teenagers,
right?
You know what I'm saying? Like, man, teenagers, we go through the motions,
right? So I have to. That's when I go back and like, okay, her brain is not fully developed yet,
right?
Right? Like, let me hone into my education. I know that at 13, you're not thinking straight, so I'm gonna give you a little break. Yeah, but so
that's good. I love that. Well, we definitely had a lot to talk about today. We've unpacked a lot. You were over there dropping some gems. Dropping some key definitions.
I wish I had that little audio, like it's like dun, dun, dun,
I might can plug that in and post though. I think I'm gonna see if I can plug that in. I might be like that and all that. But I do want to talk before we get out of here. Like, let everybody know, because I know you just started your business, right? You haven't just started, but I know you're doing it full time now, like with your business. So like, plug the people in. Let them know like what service you offer and where they can find you. And everything.
Yeah. So what do I look?
Yeah. I mean, it's a podcast, so they're gonna hear you, see you. So
I want to look at them when I tell
them.
Yeah.
Oh yeah. Okay. Yeah. You can look over there.
So you can find me by just Googling me, Shanae Benjamin. I'm a licensed clinical social worker. If you just Google me, you'll find my Psychology Today profile. I'm also in the search engine for Therapy for Black Girls, so you can find me on there. You can also find me by just coming to my website, which is visionsofhopetherapy.com. Again, visionsofhopetherapy.com. And I am coming to other platforms like TikTok, so hopefully I'll have this to kind of post and promote myself on there. But I am doing it more full time now, and this is something I really enjoy, and I want to be able to make sure everybody has access to affordable mental health, because a lot of times it's not affordable. So making sure you have access to affordable mental health. So that's why I'm really taking on this and wanting to promote it, so everybody can just have somebody to talk to if they need it, and not feel like they have to worry about if they're going to pay the power bill or see a therapist. Like, it shouldn't have to be like that. Healthcare in general. But yeah, Visions of Hope Therapy. .com, and then Shanae Benjamin. If you just Google me, it'll pop up and you can find me there. And I do free consultations. So if you want a 15-minute consultation to see if therapy with me would be something that you're interested in, then we can set that up. I do take a number of different insurances as well. And then if you go on my website, you can see all the insurances I take, and then, definitely set that up.
Awesome. Well, y'all, check in with her. It's time, check in with yourselves. That's what we need to do. And last thing, what bit of advice would you give someone like that's on the brink of wanting to go to therapy but just doesn't know how to approach it? Like, what would you say would be the best method for them to kind of take that step to open up their lives?
Yeah, I think that if someone is like kind of debating whether they should go into therapy, I think it's important to kind of ask yourself, what would it hurt? Like, what would it hurt to just kind of get some of this up off of me, get some of this trauma, get some of this heaviness, right? Like, it doesn't hurt, right? I don't know you. We're coming in a judgment-free zone. A lot of people feel like the therapist is going to judge them. That's the first thing I kind of let them know. So
what does it hurt?
What does it hurt? Like, we always exercise and do certain things to work on our physical self, right? We get our nails done, or you get a haircut.
Mm-hmm.
Like, we do the maintenance on that part of ourselves.
The external. But what are we doing internally?
Internally, you have to still. So even if you feel like, everybody could use a little tune-up.
Yeah.
Everybody could use a little maintenance. So even if you look like, okay, let me do a little check-in. It could be one session, right? It could be 1 or 2 sessions. You don't need to see a therapist like every week. It could just be something where, okay, I just need to just make sure that I'm good, I'm on the right track, and it's just another way for you to just have maintenance on yourself.
That's a perfect way to end it.
Okay.
Maintenance. I
maintenance.
Love that.
Mental maintenance. Mental maintenance. I like that. So, yeah.
MM. Okay. You might have to coin that.
Mm-hmm.
But, Shanae, I want to thank you for taking time out of your day, out of your busy schedule to come and sit down on the Southern Exchange podcast. I really do.
Of course.
You left us with some insightful and wise words, and I thank you.
You're welcome. Anytime you want to have me back, I will come, and I definitely appreciate you and wanted to be here to support you. And your platform as well. I'm really proud about the journey that you've had. Like I said, we've been knowing each other since high school.
Yeah, it's been a minute.
You were older than me, so yeah.
Yeah. Now I appreciate you, like I said, because I love where you are now. Like, and I've seen your steps and like how you progressed. Like when you opened up your business, I was just like, yeah, this is gold. Like, because people need to hear your voice, and it's some young girls out there that look like you that need to see you. You know what I mean? And especially where you carry yourself. So it's beautiful to see.
Thank you.
You're welcome. Well, guys, we're going to get out of here. Thank y'all for tuning in. I will be back with y'all soon. But in the meantime, check in on yourself, check in on your people. Southern Change Podcast. Y'all be at peace.